A lot of times we'll want to do a PET scan. Sometimes lesions are too small to show up on a PET scan. Sometimes they're ground glass nodules, which don't show up well on a PET scan. Sometimes they're carcinoid tumors, which don't show up well on a PET scan. And sometimes we also have to acknowledge the fact that PET scans are not perfect. There's anywhere from a 10 to 20% false negative rate with a PET scan, even on lesions that we know for a fact are cancer. So we have to be wary of that as well. Now, how about the accuracy of the test? When we look at those 29 patients who had cancer out of 178, what we found out is that one out of those 29 was misclassified. They were labeled as a 98% negative predictive value, which was listed as likely benign. So that's 3%. And you may be saying, well, wow, 3% of the time, this test is going to be wrong. Remember that I just told you that 10 to 20% of the time, your PET scan is wrong. Okay. So this is certainly dramatically less than that. So that's what we want to focus on. I think, again, all this is more clinical information. It's more pieces to the puzzle that finally, once I get enough pieces, I can look at the puzzle and say, oh, I know what this is a picture of. And that's what you're doing. And that PET, in certain circumstances, will give you more pieces to the puzzle. The Nodify XL2 will give you more pieces to the puzzle. Now, sometimes there'll be bigger pieces than others or more pieces to be exact. If you have a PET scan on, like you saw, that tiny little 9 millimeter thing that lit up so bright on the PET scan, that's half the puzzle right there. You know, it did it for you. But there may be other times where the PET doesn't help you at all, but the blood test does. So all of these things are really used in concert together. Nothing is considered cheating here. Use every single advantage that you have to make the right decision for your patient, whether it's your own personal experience, looking at old CAT scans, the PET scan, the blood test, Gestalt, gut feelings. Use it all because it'll help you and it'll help your patients.